I'm Aegean Chan, and I'm going to be discussing the procedures that you can get in medical offices and dermatologist offices, and going over why you may need them, what procedures are available, and how they work. I will also be dispelling commonly held misconceptions about in office procedures and how they can be used to help you achieve your personal aesthetic goals. So, for the uninitiated, bringing up office procedures like Botox and filler often brings to mind these public figures and other people that have this certain look that is very obvious they've had things injected into their faces. However, there are many patients that get these procedures done to help enhance and restore their features, and it's so subtle that no one would ever be able to tell just by looking at them. So in my practice, I view injectables, lasers, and peels as tools, just like working out, dyeing your hair, skincare products are tools to help you feel like your best self. So by the end of this talk, I want to dispel the idea that if you walk into an office to even ask about a procedure, you'll walk out looking like you belong on the cast of Real Housewives. So before we dive in, I want to make sure that you all understand your why if you're considering these procedures. Understanding why you want to pursue this is the most important point in this process. If you have a well-defined goal or endpoint, this helps set realistic expectations, and you will be much happier with the results of the treatment. Unrealistic goals will set you up for disappointment. In-office procedures are not filters, and they can't make you look like a completely different person. Again, they are just tools to help us treat your skin issues. So when you're at home, take a few minutes and look at yourself in the mirror and ask yourself, what really bothers you? What changes would you like to see? Is it the fact that you look more tired than you feel? You're noticing certain wrinkles that are bugging you? Or do you have some hyperpigmentation or sun damage that you dislike and that hasn't gone away despite all of the TikTok remedies you've tried? So once you narrow down roughly what issues you feel like you need help with, set up a consult with a skincare professional that performs these procedures like a dermatologist. They can take your issues add their own professional assessment and opinion to what should be addressed, how you can reach your goal, and make a plan with you on how to get your best results. So I know you're probably wondering at this point, who do I go see? How do I find somebody good? I wish there was a better way, but word of mouth is still the best way. Ask a friend who recently got some procedures done in your area, or ask a trusted medical provider like your primary care physician or your GYN. Chances are they do know someone good, or at least may be able to tell you who to steer clear of. I am a board certified dermatologist, so I'm the most familiar with our training, and we're the only medical specialty with 3 years of training dedicated to learning how to look at the skin, how to diagnose the skin, and treat skin disease. And using these procedures to address your issues, you really need to know what you're looking at when you look at the skin. And you also want to make sure that the person that you're seeing, is very comfortable with assessing the skin. At least in the US, I know you can check for board certifications online. In the US, there are many nurse practitioners, physician's assistants, and nurse injectors that do perform these procedures. I usually recommend seeing somebody that's within a medical practice, because there's a lot of overlap with medical conditions in the skin. And it's very reassuring if there is a knowledgeable, trained dermatologist just down the hall if the person that's treating you isn't sure of something. And since I don't have a guaranteed way of helping you find someone good, the very least I can do is share some red flags. So if you notice any of these things, it's probably a sign to keep looking. So this can be a pretty predatory industry. But I will say that most high quality providers do an in-depth consult with patients before performing any procedures, to understand and hear your concerns, to help you make a plan and work within your budget. This doesn't happen, it's a red flag. Overpromising is not realistic. Most of these treatments typically need multiple treatments to achieve a certain goal. So if they're promising you incredible results with one treatment, I would take that with a grain of salt. And lastly, if someone is overselling, pushing you to get a lot done or go outside of your budget, that probably means they don't have your best interest at heart. So, for me in my practice, I assess my patient, I make a plan for them, but I always put put the ball back in my patient's court. So we can do as much or as little as my patient wants. We can always start with one procedure, see how they feel, and move forward to the next step afterwards. So I structured this talk based on the most common concerns that patients come in with. So let's dive in. Wrinkles in the upper face. This is the most common complaint that I see. And people come in saying they don't like the 11 lines here in the mid forehead. They're noticing more crow's feet even at rest. So this starts to happen in your early to mid 30s, depending on how much sun damage you have, how much muscle movement you have. And the only treatment that is effective for this is botulinum toxin injected into these facial muscles to paralyze the underlying facial muscles. This puts your angry muscles in a temporary timeout. It reduces how much crinkling the overlying skin gets. This is actually the one treatment that is effective in one treatment. And it's great because it's temporary. So if you haven't had anything else done, you're scared of needles, this is one that's, pretty minimally invasive. And if you absolutely hate it, you're going to be back at your baseline in 6 months. And the other thing is that it does have a prejuvenation effect, which means if you start on the earlier side, you can prevent the formation of more deeper wrinkles down the road. And so my patients that start when they're in their 30s, they really have to come in just once or twice a year. So essentially, botulinum toxin, the synthetic form, prevents the nerve signal from reaching the muscle. So that results in the temporary paralysis of the underlying muscle. Specifically, botulinum toxin A cleaves a protein called SNAP25 that prevents acetylcholine, which is the messaging molecule from the nerve to the muscle, prevents that acetylcholine from being released. There are actually many now commercially available toxins on the market. They're all pretty equivalent. Botox has been around the longest, but recently I've had some great results with Jeuveau, which I really like because it has a faster onset than Botox. Within 1 to 3 days, you're about 80% there, where it takes about 5 days with Botox. But again, this toxin gets metabolized and fully broken down in about 6 months. So you will be back to baseline and none of the side effects are permanent. So this is just a diagram of where Botox can be injected, typically used to address wrinkles in the upper third of the face, but can be used on some muscles on the lower face and neck. And this is just a video to demonstrate how easy this procedure is. A very, very tiny needle is used and injected into the muscle. Feels like a little bee sting. Some patients get little welts. Those resolve about an hour after treatment. And then very rarely do I get bruising. And I usually treat more conservatively, and patients will come in at the 2-week mark for a touch up. And this usually prevents a more frozen look. So the next most common complaint I see from patients is facial sagging, and that's from volume loss in the face. Sometimes they just say, again, they look more tired than they feel. And this is from the effect of gravity pulling down our fat pads. When we're young, most of our volume is concentrated in the middle of the face. That gives you this triangle of youth here on the left. As we get older, those fat pads migrate down to the lower third of the face, and you get the square of an aged face. You also have some loss of muscle tone as well as bone structure. So to correct this, you have to add more volume in the face where it is missing. So when you put filler in the mid face, you give a more youthful proportion back to the facial volume. And when you put filler in the mid face, it also sort of pulls up everything, and it can address some of the sagging you see in the lower face. And I call this rehanging the curtains. So primarily in my practice, I use filler to restore volume and contour that's been lost. I don't usually use it in younger patients. There's been a trend against that. You've seen a lot of younger celebrities actually getting their filler dissolved. So This is very simple. You use temporary filler to add more volume to areas that have lost it, sort of like restuffing a pillow. So this diagram here on the left shows you where filler can be injected. Most practitioners do correct the midface first and then target other areas that need it. There are many different types of temporary fillers on the market. The most common type is hyaluronic acid. So Juvederm is the most common type. Restylane is another brand name. This type of filler can be easily dissolved with an enzyme called hyaluronidase, so it is a bit safer than other ones that cannot be dissolved. And it comes in many different consistencies, as you can see in this bottom diagram. There are some stiffer ones that you can use for deeper filling to really give you a lot of volume, or there's ones that are thinner that almost have a more gel water-like consistency that can be used more superficially to fill in some fine lines like the ones around the mouth. There are other types of fillers, calcium hydroxyapatite and poly-L-lactic acid. These actually stimulate your own native collagen production in addition to adding volume, and these last longer than hyaluronic acid fillers. I personally use Radiesse, which is calcium hydroxyapatite, a lot in my practice because it doesn't pull in water like the hyaluronic acid fillers and gives a nice natural contour. So filler is injected at various levels of the dermis depending on what needs to be addressed. And you can see this is an example of a woman where Radiesse was used. And I just wanted to give you an example of natural results that you can see. If you see the bottom end result, you really wouldn't flag that woman as somebody that's gotten a lot of filler injected in their face. It's important to remember that filler is a little bit more of a high risk procedure than Botox injections because you are injecting a stiffer product deeper into the skin. There is a risk of that product occluding or plugging up the arteries into your face. When you do that, you occlude the vessel and stop blood flow to a certain part of your face, and you can get pretty severe tissue death or necrosis in those areas. That is a rare risk, but it is pretty severe. You can also see infection as well as nodule formation, and you can even get blindness with fillers. So you really, really want to make sure that you're going to somebody who is qualified and skilled, that has a detailed knowledge of facial vascular anatomy. So shifting gears, I'm going to talk a little bit about lasers and how we use lasers. So redness from rosacea is a very common issue that we see in patients. This type of rosacea is very difficult to treat with topical medicines. This is due to permanently dilated blood vessels just from chronic rosacea. And this is treated with laser, most commonly with intense pulse light treatments, which is also known as IPL, BBL, or photofacials. The handpiece emits a broad wavelength of light that targets both hemoglobin, which is found in red blood vessels, red blood cells that are found in the blood vessels, as well as melanin, which makes IPL a great treatment for both redness as well as pigmentation. Most patients do require multiple treatments as well as periodic maintenance. Most importantly, IPL is not safe for darker skin type because it also targets melanin. And if you have high melanin in your skin, this can cause severe burns. So most of the adverse events, the photos I see on social media, are from IPL being used inappropriately. So this is just to show you what an IPL treatment is like. So the light is emitted from this handpiece that is being applied directly to your skin. This treatment doesn't have any downtime, is very well tolerated. It can be used for other skin conditions that have redness, such as post-inflammatory erythema in acne, as well as the acute pink stage of stretch marks. And this is a really good treatment for red-brown dyspigmentation we see in chronic sun damage. So just a word on laser. So often people use the term laser with the impression that it works like a magic wand and will fix whatever skin issue they have in just one session, but this is really not the case. Depending on what needs to be treated, it's more realistic to think about laser therapy like working out. You need multiple sessions to get the best result. Just like one workout session won't get you your ideal body, one laser session won't completely transform your skin. Slow and steady will keep your skin safe, reduce adverse events, and give you the best results in the long term. And typically, the first session is used to assess your skin's response to the laser treatment. And it's really safe practice to not use the most aggressive settings initially. So you probably won't see a very dramatic change from your first treatment. And there are different types of lasers that are used to accomplish different things. So really think of them as targeted therapies, and you need to make sure that you're getting the appropriate laser treatment to address your specific skin issue. So in general, again, like I said, there are different types of laser. This diagram shows here on the top the different types of laser and where the wavelength they emit targets. So this is the absorption curve of the different targets in the skin. So hemoglobin, red blood cells, melanin here, and water. So red, when you use a KTP laser or pulse dye laser, that will specifically target redness here from this peak. Melanin is targeted in this area, and then water is targeted here. And when you target water, you're actually targeting the superficial layers of the skin that gets vaporized, and that's when you get a nice result for these sort of fine etched lines that you can see. So acne scarring is another very common issue that we see come into the clinic. And this is an interesting case study because you really do need to use multiple modalities to treat acne scarring. So acne scarring typically consists of post-inflammatory erythema, so that redness, which does resolve over time if you're on a good topical treatment regimen, but laser can speed it up, as you saw with the IPL treatments. Chemical peels also can help fade that a little bit faster. Post-inflammatory hyperpigmentation, or that brown, that also is seen often in acne, typically in patients that do have darker skin types. And primarily, chemical peels can help speed that process along a little bit. It just helps slough off that superficial pigment and fades it over time. And then atrophic scarring, so those ice pick and boxcar scars that you can see in acne, that really needs to be treated with procedures that wound the skin and cause the stimulation of new healthy collagen rather than that bound down scarred collagen. So we do that using microneedling, subcision, where we take a needle to sort of loosen up the bound down collagen and lift that. And then ablative resurfacing laser can also use to help sand and even down the skin texture. So a word on chemical peels. I love them. They're versatile and can be used to treat a wide range of concerns like acne scarring, melasma, and sun damage. They are more cost effective in comparison to laser, and they tend to be safer for skin of color. I use the brand VI Peel, and that was developed on skin of color, so that's a safe bet for most people. So a chemical peel is when peeling agents like glycolic acid, trichloroacetic acid, salicylic acid, or a blend are applied to the skin. And this can be done at home in an esthetician's office or in a medical office. Peels at home and at esthetician's office are more superficial. They are safer, but are a little bit less effective. Medical offices typically administer medium depth peels, which go down to the deeper epidermis or dermis. And this is more effective at treating issues that would benefit from collagen stimulation, such as extensive sun damage, fine lines, and acne scarring. These peels are more intense. They typically have more peeling, like the sheets of peeling you can see in this photo. They have more downtime, can be a little more painful, and there is a higher risk of scarring. And then finally, a little bit about microneedling. So this became extremely popular a few years ago, especially with this selfie. And this treatment typically uses very teeny tiny needles, as you can see here in this diagram, to penetrate the skin and cause controlled wounding, which then stimulates the growth of new healthy collagen. So, in office microneedling goes deeper than the at home devices, typically between 1 to 2 millimeters, that really targets the sort of mid dermis where a lot of this damaged collagen is. And it's used to, again, treat scarring, skin texture concerns, and sun damaged skin. When you leave the office, you will look like your face went through a meat grinder, but the downtime is actually pretty minimal, about 1 to 2 days. It looks more painful than it is because your face is numbed prior to the treatment. And the cost tends to be comparable to chemical peels. In my practice, I use it mostly for acne scarring. I do find that laser is a little bit more effective for rejuvenation. You may have heard of radio frequency microneedling. The brand name is Morpheus 8. That uses a radio frequency heat in addition to the actual wounding with the needles. So that can stimulate more collagen growth, and you can get a little bit more tightening with that. But I have heard anecdotally that that treatment, it can be quite painful. So that is it for our whirlwind tour of the most common treatments available in medical offices to treat your aesthetic concerns. We didn't have time to cover everything, but I hope that this helps clarify some misconceptions and gives you some tools to help and confidence to help explore these options for yourself. Um, Roughly, if you're spending more than $500 to $1,000 a year on products, devices, facials, it might be worth pursuing some of these in-office treatments to reach your goal. So remember to make sure you're being treated by a qualified and knowledgeable provider. And this is a marathon, not a sprint. You will get the best results with long-term sort of consistent planning and working with the same provider. So if you have any more questions, I will be available to answer those right now, or you can find me on Instagram or TikTok. Thank you.